Radioactive iodine therapy is a specialized form of treatment that is especially used in certain types of thyroid cancers. Now, what happens is generally, as we know from our childhood days that iodine is very, very important for thyroid gland. So, whenever iodine is taken into the body, it goes in the thyroid gland and it metabolizes. So, what happens in thyroid cancer is once the surgery is done, if we are suspecting that some amount of tumor may be there, or if there was an extensive tumor, some of these tumors will respond to iodine, that is they will take up iodine. So what we do is along with that iodine, that iodine is made radioactive. So what it means that the iodine will emit small amounts of radiation, but it will be limited to the very close area surrounding it. So as soon as radioactive iodine is ingested, it will be taken up by the thyroid gland, and once the thyroid gland takes it up, because of the radioactive property, the cells, the cancer cells that is in close proximity of these thyroid cells, it gets killed. So that is how radioactive iodine acts as a very, very effective modality of therapy. Now, how do we prepare the patient, or how is it done? So generally, for it to act very well, the body should be kept on a iodine deficit diet, because if already iodine is there, then whatever extra radioactive iodine you give, the body will not take it up. So he or she is kept for iodine deficit diet anywhere between 2 weeks to 4 weeks. That means having less of iodized salt, less of iodine rich foods, so that we put the body in a condition where iodine is very, very less. So as soon as you give radioactive iodine, the body, the thyroid gland takes it up, or wherever the tumor is there, that will take it up and gets destroyed. So once that he is kept on iodine diet and necessary blood test, thyroid test, and other routine parameters are done. So once that is done, you are advised admission, because it involves radioactive iodine. It is not generally harmful for anybody, but just to be safe, you will be admitted in a separate ward. Generally, the sessions it anywhere depends on one sitting to two sittings, depending on what type of cancer, what dose you are receiving. That again will be calculated by your doctor. So once that is done, you will be admitted in a separate unit. You will be given a separate room, a separate utensil, and separate clothes and everything, so that you don't mingle with other patients or other relatives or visitors. And generally, visitors are not allowed. Nobody is allowed to interact with you for another 3 to 5 days. It is just to be safe, because it has radioactive property. If unknowingly anybody, any child or any pregnant woman come in contact with you, it may cause some mild harm. So just to prevent all that, you are kept in a separate room. So after the treatment, the doctor will make sure that they'll do the tests and make sure that whatever iodine level is there, that is well below the permissible limit, and then you are discharged. So it will not cause you any harm, because whatever the radioactive iodine we are telling, that acts at very, very molecular level. So that effect is only till that micromillimeters. So beyond that, there is no effect. But still, we take precautions that according to our government and other principles. So once that is done, once you go home for another 2 to 3 days, you will be generally told not to mingle much with young kids if they are at home, or pregnant ladies if they are at home. But generally, after 3 to 4 days, you can go back to your routine normal activity. And by 7 days, you can even go back to work and other things. So, what side effects you can anticipate is some amount of nausea will be there, and some amount of metallic taste may be there, and some gastritis could be there. Some headache can happen. Apart from that, it is very tolerated procedure. Generally, no major side effects occur. So that will be one sitting. Again, if you want to undergo one more sitting, the same procedure you will have to undergo. Generally, it is for 1 to 2 sittings, depending on what your tumor stage and everything is. So that is in brief about radioiodine therapy. But your doctor will give you a detailed explanation about the pre procedures, during, and post procedures.